Balasubramanian. We were talking something about breathlessness, and I explained the actual meaning of every term which we use to simply say that we have some difficulty in breathing. And I told what is actually breathlessness. Today I'll tell that actually. The first thing is breathing and respiration are different. Breathing is an act. You take in air and give out air. Respiration is a process, exchange of gases. So oxygen is taken in by the body and carbon dioxide is given out. This is exchange of gases. So this process is called respiration. Now, at rest, when you are not doing any physical work, when you are not emotionally disturbed, we call it at rest. Physical rest as well as mental rest. At that time, your need or demand may be very less, so it is met with. The air, the amount of air you require, the amount of air you breathe in and out, the amount of oxygen your body needs is very less when you are at rest. When the demand increases or when the need increases, for a simple example, when you do an exercise, naturally you need more oxygen, so you would like to take more air inside to meet the demand. If the demand is met, you are healthy and you know how much you can exercise. You will not go beyond that limit. When you feel that demand is not met, then you will immediately stop exercising and take some rest, and again you will do the exercise. This is a natural phenomenon. If the demand is not met with, if you suffer because of this excess need, how long you suffer to become normal and how much you suffer to become normal will decide whether you are a normal, healthy person or not. Normally, also, you can have breathlessness, for example, exercise. When it becomes abnormal, for example, if you do half an hour exercise, a mild exercise, and you don't feel any breathlessness, okay, you're all right. But if you do the same exercise, within 10 minutes, you become breathlessness, which you have been doing all those previously, then now you realize that there is something abnormal in you because you are not able to do the normal exercise. Acceptable. Now, how will you measure this breathlessness, whether you are normal or not, and how this excess air you need, the excess oxygen you need, how it is met with by our body? Before knowing that, you should know things that we are doing from birth without our knowledge, and we don't bother about it till we get a problem in that. So, what is that? First of all, do you know how much of air we breathe in and breathe out in one cycle of breathing? So, what is this one cycle? You have two components: taking in of air and sending it out. You call it one cycle. This taking in is called inhalation or inspiration. This sending out is called exhalation or expiration. So one inhalation or inspiration plus one exhalation or expiration, this is called one respiratory cycle. The air which you are taking in will have more oxygen. The air which is coming out from your lungs will have more carbon dioxide and less oxygen. At rest, the quantity of air which you are taking in is equal to 500 ml of. So we take only 500 ml of air at rest. So you inspire 500 ml of air and you expire the same 500 ml. The normal quantity of air which is inhaled and exhaled at rest, you call it tidal volume, which is equal to 500 ml. We all know heart rate, or what you call the pulse rate. That is the number of times the heart contracts and relaxes per minute. You call it a beat. So the heart beats. How many times the heart beats in 1 minute? We all know, and we call it pulse rate or heart rate, which is equal to, we all say 70 to 72 beats. You call it 70 beats per minute. How many times you breathe in and out in 1 minute? The heart has a rate of 70 beats per minute in 1 minute. How many times we breathe in and out per minute? At rest, when we are not doing anything, well, for an adult, it is around 12 to 16 times per minute. The respiratory cycle, inspiration and expiration, you call it one cycle, you are doing 12 to 16 times in 1 minute. This is called a respiratory rate. Like heart rate, this is respiratory rate. So you have 12 to 16 cycles in 1 minute, and if you see in a pulse oximeter, you will have two letters RR. This RR in pulse oximeter denotes respiratory rate, and you can see in the pulse oximeter RR. Of course, the other thing you see in a pulse oximeter is the oxygen saturation percentage, and also you will see the heart rate. Okay, so we will consider for calculation purpose 12 times in 1 minute. That means, so the respiratory rate, we take it as, for calculation purpose, we take it 12 per minute. That means 12 cycles in 60 seconds, that is 1 minute. Then what will be the duration of one cycle? So 60 divided by 12 cycles is equal to 5 seconds. What does that mean? That means you are taking in this 500 ml of air and sending it out. This act, taking in air and giving out air, you are doing it in within 5 seconds. So one cycle time is 5 seconds. In this 5 seconds, you are taking air in 2 seconds, and 3 seconds you spend in sending the air out. So inspiratory time is 2 seconds, the expiratory time is 3 seconds. Something like a balloon. You are inflating a balloon and you are deflating a balloon. Inflating a balloon is an active process. You have to blow air, but once you stop blowing, naturally the balloon collapses. That means that is a recoiling. We call it in lungs, it is called a recoil. So like a balloon, these 2 seconds you have to actively take air in, and the next 3 seconds it happens passively like a balloon when the air comes out once you stop blowing air inside. Okay, now come to your calculation. In one inspiration, we are taking 500 ml of air. How many times do we breathe in and out? 12 times. So how much of air we are taking in 1 minute, which is equal to 500 ml into 12 respiratory cycles. That means 6000 ml of air we are breathing in and out in 1 minute. Suppose a person is having COVID, CT lung, and he is found out to be having pneumonia, in which the air sacs out of the alveoli is filled with a fluid because of the pneumonia, an inflammatory fluid inside the alveoli or the air sac. Not only that, the area which is surrounding the alveoli, there also you have fluid. So inside the alveoli you have some fluid, and outside also it is surrounded by fluid. Inside fluid prevents the gas exchange because it's a barrier. The outside fluid prevents the expansion of the alveoli So now also amount of air which is going in is prevented. Now an effortless process of inspiration, it becomes a process with the effort because you are trying to expand the alveoli against a resistance. The resistance is nothing but the fluid surrounding the alveoli. Now imagine, just see the image. If, for calculation purpose, if the CT findings shows that your lung is involved 50%, 50% of the lung is affected. In every inhalation, instead of this 500 ml, you will take only 250 ml because the air sac is filled with fluid, the air sac is surrounded with fluid. So naturally, during a normal breath, I used to take 500 ml, the lung is normal. Now 50% of the lung is involved, so I can only take 250 ml per inspiration. I am used to this 500 ml, so I have to breathe in and out twice. That means 2 cycles to get this 500 ml. So in a normal person, one cycle we take 500 ml. In a person who has got 50% involvement of the lung in pneumonia, a COVID pneumonia, to get that 500 ml, I have to breathe 2 times. Now my respiratory rate is doubled. During normal times at rest, I used to breathe 12 times in 1 minute, and in every time I take 500 ml of air. Now because 50% of the lung is not functioning well, so to get this 500 ml of air, I have to breathe in out 24 times. That is normally 12 times, now it is 24 times. So what does that mean? At rest, my respiratory rate was 12. Because of this problem, my respiratory rate was 24. Now the time taken for each cycle is halved. That means usually the time taken will be 5 seconds per cycle. Now it becomes 2.5 seconds. Now the time is shortened. One cycle halved. Now I say I have breathlessness or shortness of breath. I am breathing fast. Even though the respiratory rate increases, the purpose of this respiration is not achieved. The purpose of this breathing is not achieved because of the fluid which becomes a barrier inside the alveoli and outside alveoli. The gaseous exchange is impaired because of the fluid, and naturally, even though you increase the respiratory rate, the quantity of oxygen which your body is getting is lessened. So your oxygen saturation starts going down. And one more thing, remember, when this respiratory rate increases, the heart has to pump with more vigor and more times to pump more blood to the lungs to receive whatever oxygen is there. So heart rate also increases. Now if you see the pulse oximeter, your oxygen saturation is less, your respiratory rate is more, and your heart rate is more. As far as COVID is concerned, when a person needs assisted ventilation, either an oxygen concentrator or a ventilator, so we always count if the respiratory rate is above 25 and more than 25, the patient may need assisted ventilation. Now the respiratory rate, one factor that decides an assisted ventilation or that decides the breathlessness. Because of this less saturation, the oxygen saturation goes down. So in a person COVID with around 50% of involvement of the lung, which is not taking part in the gaseous exchange, or I have to double the rate of respiration. In spite of this increase in respiratory rate, lack of gaseous exchange, so oxygen saturation goes down. So now you become breathlessness as well as hypoxia, low oxygen in the blood. You go for hypoxia, Now you need assisted ventilation. So now from this, what you know is breathlessness is measured by one thing: the rate of respiration. Respiratory rate increases, and then the oxygen saturation also decreases. So this decides, and this is what is actually called breathlessness or shortness of breath, whatever it may be. And remember, it is one of the criteria to start assisted ventilation. Now you know what is breathlessness, shortness of breath, respiratory rate, heart rate, oxygen saturation, and the measurements you see in a pulse oximeter. So this is what I wanted to give you, and I think we'll see in the next video with some other topic. Thank you.